For our third session of day 2 of the Covering Rare Diseases Fellowship, we'll shift our focus to Europe. Organizations like Orphanet, EUCERD, and Foundation Ipsen are leading the pathways towards innovation, advocacy, and equity in the rare disease space. Today, we're joined by Charlotte Rodwell, the Strategic Communications Officer at Orphanet, who leads their business development and tech transfer initiatives. For the past 4 years, Charlotte has led Orphanet's partnerships and communications activities, and in particular heading the Orpha News team. She's also supporting the literature review of Rare 2030, which is a project that seeks to develop policy that will yield a fairer and brighter future for people living with rare diseases. Charlotte, thank you so much for joining us today. Please take it away.
Hello, everybody. Thank you for inviting me, Rachel, to be part of this this fellowship, and I'm very pleased to see you. And hello, good morning, afternoon, or evening, wherever you may be. So, as Rachel says, I'm working at Orphanet. It's the rare disease knowledge base that's based in Paris, where I'm talking to you from. And has been around since 1997. I've passed in my past lives in the rare disease field, been very much involved in the policy field as part of the scientific secretariat of a succession of EU expert groups on rare diseases. So I'm going to talk to you today about this rare disease political ecosystem that we've developed in Europe, and I'm hoping by the end of the session I've helped you understand a little more about how the concept of rare diseases as a public health priority with an EU added value has emerged over the past 25 years, understand how EU rare disease policies evolved and came to be, understand what we've achieved to date at European level with a particular focus on a couple of flagship initiatives at EU level, that being the Orphanet Rare Disease Knowledge Base and European reference networks for the care and understanding of rare diseases. And then I'll tell you how we have worked to look at how to develop better rare disease policy for the future through the Rare 2030 project that was mandated by the European Parliament. And finally, I'll just have a little side note at the end of how this European experience might help provide experiences and exchange of experience for other world regions in the future. So I know you've had primers probably over the past day or so as to what is a rare disease, but we know that it's very important to speak the same language when we're talking about an issue. So I'm just going to give you our European focused view on what is a rare disease, the definitions, why I've decided to focus on it as a public health priority, and why we thought a cross-border approach is needed. So rare diseases, you may have seen in the past day, are defined at European level through the 2000 European Orphan Drug Regulation as affecting not more than 1 in 2,000 inhabitants in the European Union. So we're looking at around 6,000 rare diseases, including 200 rare cancers, because rare cancers make up the rare diseases sphere. And this affects around 30 million European citizens and around 300 million people worldwide, at a conservative estimate. Most rare diseases concern a small numbers of patients individually, but as you see, it amounts to a lot of people worldwide. These diseases are clinically heterogeneous. Most start in childhood, affecting about 70% of them, in fact, but they're mostly chronic and disabling, with a very impressive and important impact on daily life. Rare diseases include, but not limited to, rare genetic diseases. Around 72% of rare diseases are genetic, but not all are genetic in origin. And what we see are patients or people living with rare diseases that wait between 5 to 30 years to be diagnosed, going through a real diagnostic odyssey. 40% are misdiagnosed and incorrectly treated, with repercussions on their outcome and prognosis. There is, of course, a poor recognition that is compounded by inappropriate coding and health information systems, meaning that we don't capitalize on the knowledge that could be available. And there is a need of specific expertise. In Europe, this resides in the European reference networks I will describe to you later. And of course, it's an issue that not only experts need to know about, but also general practitioners and also health professionals who cannot know about every single rare diseases. They need to at least know that they exist and how to get to the appropriate point of care so they can accurately and efficiently orientate their patients so there is no loss of opportunity. So just to come to this question of a definition, you might know already that rare disease, of course, are defined by their low prevalence in most policy and legislative frameworks, which are often orphan drug regulations around the world. And as I cited before, Europe has a specific definition, but this also varies from country to country in the different texts that have been produced. And is often a reflection, of course, of the issues around market size leading to unavailability of drugs and also the population burden of the disease. And for some diseases, prevalence isn't the best measure. Sometimes it's incidence, and this is the case for rare cancers and rare infectious diseases. Now, rare diseases are a field where there is not just the question of rarity, but also a specific set of specific challenges that describe this group. Of course, we talked about how limited the rarity means limited knowledge of diseases and scattered expertise, and also a lack of general awareness by the general public. It means that these diseases are also too rare to be known by medical professionals outside of specific areas, and often not taught in the medical training of doctors. They're too rare to be considered a public health priority by policymakers and too rare to represent an attractive market for drug development. And as I said, this rarity and lack of knowledge around rare disease means a long diagnostic journey, which turns into an odyssey for most. Here's a little slide that helps you understand better the global distribution of rare diseases and people living with rare diseases. What we can see from analysis of the Orphanet knowledge base around the prevalence of rare diseases known to date is that most rare diseases, around 90%, are very rare with a prevalence of less than 1 in 100,000, but most of the patient population is concentrated on the 390 most prevalent diseases, meaning there's a lot of rare diseases where there are very few, maybe just 1 or 2 cases per disease, and where there is really no knowledge, and people, of course, are suffering from a lack of knowledge and responses to their healthcare needs. I said earlier that we didn't have an international definition of rare diseases because of course, every country has their different legislative approach and definitions, but we have been working at international level to arrive to an endorsement of an international operational description of rare diseases so that we're all speaking the same language when we come to this topic. So this is being read by Rare Diseases International. You might already have heard of them. So this is an international advocacy organization, and under a mandate from the World Health Organization, we brought together experts to come to a common definition we work on together to understand rare diseases, and we arrived at a rare disease being a medical condition with a specific pattern of clinical signs, symptoms, and findings that affects fewer or equal to 1 in 2,000 persons in any WHO defined region of the world. You can read and learn more about this if it interests you using the QR code, and I'll make these slides available after. So now turning to the main body of my presentation today, I wanted to explain to you how European policies on rare diseases occurred and where we are to date and where we want to go forward from there. As you may know, the EU treaties do not foresee a common health policy in the European Union level, but member states are able to collaborate on identified public health themes, and this is what happened around the year 2000 in Europe. The European Commission, often advised by ad hoc expert bodies such as the committees on rare diseases I've been part of, can instigate work on the topic of cooperation and then lead to texts being adopted by the Council of Ministers, which have a representative from each member state of the European Union. On the research side, there is a possibility to have common research policies and coordinate actions, which is important when there are few resources and many topics to deal with in the rare disease field. And this is a budget defined through the co-decision process, the European budget making. Rare diseases have been defined over the years as a clear area where the European Union can have an added value in terms of cooperation. And the existence of the European Union has perhaps helped cross-border approaches in rare diseases emerge sooner in the policies in Europe than maybe other world regions. Here is a little diagram I like to show that shows you what happened between the year 2000 and the year 2014, where we have the end of one of the main European policies on rare diseases, to show you how it's important to see how an emergence of a multi-stakeholder community can help drive change. What we'll see is over the years, there are patient organizations and bodies such as Orphanet that emerge, help structure the discourse around rare diseases and push and advocate for policy to respond to rare disease challenges. And this is what happened in Europe, and this developing a community of stakeholders and having moments for stakeholders to meet, such as the expert committees the European Union, the European Commission helped support, meant that we're able to advance and discuss on what is needed and form policy around it. So I'd like to bear that in mind, this importance of this this kind of drivers to change when we're talking about the emergence of policy. This is a little timeline that you'll have for afterwards to have the key moments in the rare disease world in Europe in the past 20 years. So as I said, the first real text that talks about rare diseases and establishes a definition is this European Regulation on Orphan Drugs in the year 2000. And then we have rare diseases included as a policy priority in the research and health programs at the European Union level. This is important because there is support given to the creation of expert groups at the European Commission that help talk around this subject of rare disease policy and discuss ideas around how to structure the expertise for rare diseases in European reference networks. What I want to focus on today is what happened in 2009 is real first comprehensive policy at European level on rare diseases, and that's the EU Council recommendation on an action of rare diseases. So just to explain how we worked during this period at European level is we had a number of different successive multi-stakeholder expert groups. When I say multi-stakeholder, that meant there were patient organizations, there were researchers, clinicians, there were members of the industry and members of every member state, usually from the health ministry, that were around the table from 2004 to 2016 to discuss measures and policies and recommendations in the collaborative sphere in the European level to bring about change for people living with rare diseases. So through the EU Health Programme, we had support financially and with means to organise workshops, meetings, and conferences so that we could foster knowledge sharing and co-construct these measures for the future. This resulted in the issuing of a number of recommendations, such on what is a centre of expertise for rare diseases, what should it do, what are its missions, how should European reference networks, so networking expertise for rare diseases, work in the future, how do we capitalise on rare disease registries, how can we better work on registry collection of data, questions around coding and visibility of rare diseases, how do we help facilitate cross-border genetic testing? How do we assess the clinical added value of orphan drugs and aspects around reimbursement, newborn screening, and what specialised social services should be available for rare diseases? So the mandate helped cover discussion on a lot of different topics, and we also helped support fostering knowledge exchange through the construction of annual state-of-the-art of rare disease activity reports that documented what happened at national and European level in the year previous. That helped so member states could share what they have done and learn from everybody else's experience. So that's just the mechanism that we use to advance in this multi-stakeholder environment at European level during that period. So as I said, this main text that I wanted to highlight that had brought about a lot of change at European level is this Council recommendation from the Council of Ministers at European Union level. So it recommends strongly, although they could not oblige member states to do so, to elaborate a national plan of strategy for rare diseases that should be holistic in nature. So they were supposed to be comprehensive and structure the healthcare offer for rare diseases and not just look at treatments for rare diseases as previous orphan drug legislations might have in the different countries. It should identify the expertise in the country, the expert centres, or foster their creation with a view to building these European reference networks of healthcare providers for rare diseases in the future. They should foster research on rare diseases and should have considered also the social aspects. So it was quite broad in scope. It also promoted this text, improved codification of rare diseases and health information systems through author-coding, promoting gathering expertise on rare diseases at European level. It set out the ambitions for the creation of the European reference networks that I will talk about later, and promoted empowerment of patient organizations because it was recognized from the start the driving force they were in the field. And it also talks quite importantly about the need to ensure sustainability of all these infrastructures that was recommended to be built at the time. So coming on to the outcomes of this legislation, or this recommendation rather, at the end of 2014, well, in 2014, by the deadline that was established for plans being put into place by 2013, we see that 18 member states had adopted a plan strategy, 6 had submitted them to national authorities, and 4 were nearly there in the finalization stages. And in fact, in France, who had the first national plan for rare diseases in the European sphere in 2004, they were already on their second plan at this point in time. What did these plans include in the end? Well, they were quite heterogeneous, and some plans were more high level and necessitated transposition into a concrete action plan, and some did not even have dedicated budgets. So there somehow were more a political message rather than actually putting into maybe more concrete policy measures. But most plans did have the 4 following established priorities. So identification of the centers of expertise for rare diseases that will be necessary for creation of European reference networks, the implementation of author codes to codify rare disease data, an emphasis on registering rare diseases in a national register database to know where the patients are for both a better knowledge of the needs and also of the capability to conduct research. And then there was also an emphasis on promoting access to information on rare diseases, so support to national Orphanet activities. I'd like to highlight the designation or the identification of expertise for rare diseases as being one of the success stories of this moment in our rare disease policy in Europe. I mean, prior to this 2009 Council recommendation and the Cross-Border Healthcare Directive in 2011, only 6 countries in the EU had designated their rare disease expertise, albeit in a non-homogeneous fashion. But by the time of the Cross-Border Healthcare Directive came about, most countries had designated their expertise and had applied the quality criteria that we discussed together in the EU multi-stakeholder committees on rare diseases, so that we all had a common understanding of what a centre of expertise for rare disease was, and this really provided a more solid ground for the constitution of the European reference networks, as you will see later. So these European reference networks, this topic might be known to some of you already, but it's a networking that's made that was realised through the Cross-Border Healthcare Directive of 2011, which was a EU legislative text transposed into national legislation that allows for patients to seek care in different European countries. So in 2017, the European reference networks, around 24 of them by clinical specialties, were established. The membership was extended in 2019 to bring in countries more towards the east of Europe and extend competencies. The aim of these networks are to facilitate discussion on complex or rare diseases and conditions that require very highly specialized treatment and concentrated knowledge and resources. Also, these European reference networks have a specific clinical patient management system to manage patients across border. So around 900 healthcare providers across Europe make up the ERNs in over 300 hospitals and over 26 member states. So the healthcare providers are designated by the national authorities, and the fact that the groundwork had been laid through the national plans for rare diseases and the designation processes helped greatly. There's supervision by a board of member states, which are coordinated on a rotating basis by the 24 ERN coordinators. So to date, these are quite new networks, but show already that they're having a great impact. It's really defined as one of the flagship initiatives for rare diseases at the European level, and show what can be achieved by working across borders. And indeed, during the COVID crisis, the clinical patient management system of the ERNs was kind of was used to respond to the need to gather information on these cases that were popping up, and we needed to discuss through virtual boards between different countries. So this is a little overview of the ERN's missions. As I said, they have a role both in the care and the research spheres. They're supposed to act as this link between the expertise that's gathered in the European reference network and also the point of care for the patients at national level. So there is this is to use this the added value of working together at European level to promote access to expertise and ensure equity across countries. As you know, patients are scattered, the expertise is scattered, and this helps patients who might not have an expert in their country access expertise by a sharing of maybe virtual consultations, development of guidelines to increase competency at national level, training in knowledge exchange, and of course on the research side, it helps bring together critical mass of data to help improve the understanding of rare diseases and develop new treatments and new approaches to treat rare diseases. Now, I highlight the ERNs as one of the flagship initiatives at EU level for EU policy on rare diseases and what the EU funds. Orphanet is the other flagship initiative, and we can consider this to be maybe the European Reference Network for Information and Knowledge on Rare Diseases. So Orphanet is, for those who don't know it already, is a multilingual knowledge base on rare diseases and orphan drugs that's freely available to everyone. It's available via a sort of web portal called orpha.net, and also for research purposes, we make massive data sets available via this Orpha data platform and an ontology. We were established in 1997. We're now an international network of over 40 countries contributing to the database, and we're coordinated at France's National Institute for Health in Medical Research and co-funded by the European Union's health programme. Orphanet also produces a standard nomenclature of rare diseases called Orphacodes and is recognised as a best practice at EU level. We'll talk about this importance of coding afterwards. And Orphanet's data platform is recognised now as a global core biodata resource of importance for the rare disease research, for the international biodata research community. We have three main missions, so improving knowledge and information on rare diseases and providing high quality information on rare diseases, improving the visibility of diseases through the codification with Orphacodes, and generating knowledge on rare diseases. I'd like to just also highlight that one of our credos is really equal access to expert rare diseases for knowledge for all. So to bear in mind, we make all our data available freely to consult via Orpha.net. There's no login, no subscription fee. We've expanded over the past 27 years the number of languages in which we make the information available to all. We're now 9 languages available, and many other external resources and texts are available in additional languages. And we work with experts from around the world to gather knowledge on rare diseases. And indeed, our global network helps collect the data on the different resources, such as centres of expertise, patient organisations, clinical trials at national level, so that this data and information is available to all. So patients and families, policymakers, health professionals, researchers, and industry members alike can use the data in Orphanet. So this is a little overview to show you the Orphanet network. So these are where our partner countries are around the world who are adding data into the database. We have around 20 million users per year. We have about 5 million combined data elements, and on the 6,000 rare diseases that we have in the database, we've to date, for example, collected 8,500 information on 8,500 different expert centres that are available in the knowledge base. Now, I'm not going to go into a tremendous amount of detail today, just to know what you can access and what might be useful for you in the Orphanet database. So everything is structured around our nomenclature of rare diseases that I'll describe shortly afterwards. And what we do is we annotate different scientific, textual, and resource-based knowledge with the appropriate disease, rare disease, so that when somebody goes and consults Orphanet, they can access all this knowledge by entering in the name of a disease or a gene in their search field. So, and we make, as I said, the knowledge that's in this knowledge base available for different purposes, different users, different end users. If you're a researcher, a patient, or if you're developing an information tool through different sorts of platforms. If you're looking for a disease on Orphanet, you'll come up with this page that allows you to have a short definition of the disease you're looking for, consult the prevalence of the disease, consult then a textual summary of the disease, and then have access to different texts, clinical guidelines, emergency guidelines on this disease, and then associated resources that I will detail here. For example, a user will be able to know if there's a patient organization available for this disease, where is the expertise in their country, where are the expert centers, who can they consult, where the diagnostic labs and what tests are available for this disease and where. And then they can also find out what is the ongoing state of research of the disease. What are the research projects, the clinical trials that are ongoing and recruiting, the patient registries, and so on and so forth. So they can also find out if there is a drug or a designation for an orphan drug for this disease. So it's a very rich, a rich source of information for all stakeholders that's freely available. Before I leave the topic of Orphanet, I'd just like to put a little highlight on the Orpha codes. So this is the nomenclature for rare diseases that's maintained and recognized more and more on international level as being the standard and perhaps the only specific nomenclature dedicated to rare diseases. So why is it important to have a standard way of describing diseases? Well, it helps improve their visibility. So rare disease data we've seen is rare and scattered, and one of the problems is identifying this data. So the idea is if you have this you use this common way of describing them with these common codes, we'll all be speaking the same language and we'll be able to amass a critical mass of information for solid epidemiological studies, produce data for public health and health economics purposes, and document better the natural history of rare diseases. So, so to date, we maintain this nomenclature where it has this code that's specific to the disease that doesn't change over time. We put in the synonyms that also you can find for this disease, and we cross-reference with different nomenclatures so we can act as an interoperability key for other when used with other terminologies. And also what we try to do is improve the number of translations of the nomenclature so that we, in the end, use it through this code. We're all speaking the same language, that we know that when we're talking about this number, that we're talking about this the same disease across languages, and that between the spheres of care and research, when we've put into place the Orphanet nomenclature, that we are bringing the knowledge on the same disease together, so we can advance with our research and healthcare planning. To close up on this topic, I'll just highlight that on this side we have specific support from the European Commission, thanks to the EU health programs, to reinforce the capabilities for implementing Orpha codes at national level and European level, with a close interaction between Orphanet and European reference networks. And hopefully in the end this will lead to a healthier and more detailed amount of data in the aim of constituting what we call the European health data space, where we'll be able to amass more data on rare diseases and have a better formed approach to how to respond to this policy need. Of course, too little time to talk today in detail about the European rare disease research ecosystem, but you may like to be aware that from 2009, there's been a structured European joint program on rare diseases with 5 years of support to bring together about 130 institutions and European reference networks across 35 countries to work on topics such as transnational funding calls, coordinated access to different data and services for research on rare diseases, training and empowerment programs, and innovation and clinical trial support. So the aim of this structuring program was to improve the integration, efficacy, and production and social impact of research on rare diseases, and also implement and further develop efficient models of financial support for all types of rare diseases, research on rare diseases. So this is first 5 years that will be now we've learned to be followed up by a very ambitious 7-year European partnership for rare disease research, which will be coming up soon. So this is a positive way of showing that how you can really structure cross-border approaches to rare disease research ecosystem. Just a little noise in the office. I'm just going to. So here coming to what we're going to see in the future. So a couple of years back, the European Parliament mandated through a specific project, a project called Rare 2030, which was aimed to take stock of the evolutions over the past 20 years of European policy and to bring stakeholders across Europe together along with young citizens to work towards a new vision for renewed European policy for the next 10 or 20 years. The idea was to be extremely ambitious and see what we wanted as a scenario and backcast and see what we needed to put into place to get there. So I will provide you these links afterwards, but there were a set of recommendations that I'll discuss now that we brought into place. What was particularly interesting in this area is that we tried to really think out some cliched way of it, think outside the box of what we wanted and how we could get there, and also bringing in these young voices from young Europeans to see what they wanted to see in the future. So this is the scenario that we chose out of the 4 that we defined as being possible for the future on this axis of attitudes of society towards solidarity and types of innovation. So we decided that we wanted to see a Europe for rare diseases that had collective accountability and solidarity between citizens and countries with diseases as a policy priority. And we want to see research that was not market-led, but patient needs-led, with a deep understanding of needs as a starting point in innovation process. So we had this scenario in head of investment for social justice. So this is what came out of the vote from our different stakeholder conferences. And we came about with these 8 main pillars of focus for our recommendation that you can see in detail through the document that I'll link at the end of the presentation. And we said the health of 30 million people living with a rare disease in Europe should not be left to luck or chance. So we wanted a structured approach in future policy to bring about long-term integrated European national plans and strategies, earlier, faster, more accurate diagnosis, access to high-quality healthcare, optimization of data for patient and social benefit, integrated and person-centered care, partnership with patients, innovative and needs-led research and development, and available, accessible, and affordable treatments. So following on from these recommendations, which were presented to the European Parliament in 2021, EUCERD launched so EUCERD being the European Organization for Rare Diseases, launched a call for an action plan on rare diseases, collecting different opinions for European citizens through a campaign called 30 Million Reasons, which were to document the reasons we found for Europe to take action on rare diseases. So this call was supported by the French and Czech EU presidencies in 2022, resulting in a specific presidency call during the Czech EU presidency at the EPSCO Council meeting, which was endorsed by 21 of the member states at the end of last year. And there's been a recent high-level conference during the Spanish presidency that has reinforced the call for this. So we're hoping that there will be movement on this, knowing there are elections coming up at European level soon. So this also has a role to play in timelines, of course. So that's where we are today. And so I encourage you to have a look at this 30 Million Reasons campaign and also the Rare 2030 recommendations to see in more detail how we're wanting to get to our preferred policy scenario. On the issue of orphan drugs, I haven't gone into much detail because we have very little time, but just to make you aware that in 2020, there was started a review of the EU and orphan drug pediatric the orphan drug and pediatric drugs legislation, which came to the conclusion that there were positive things coming out of course, this legislation, but there was still a lack of medicines in the areas where the need for medicines are the greatest, and too much concentration on treatments for perhaps for rare cancers. So there are ways to be, there are improvements to be made, of course, in the future on that side. And there is a current revision of the EU pharmaceutical legislation where, of course, we are very active in the advocacy for promoting improvements for rare disease treatments. So to end this session, I'd like to highlight the work between European actors and other world regions over the past few years, and how we hope to help share the lessons we've learned from our experiences. So what we've seen over the past 10, 15, 20 years is a global rare disease community that's getting stronger year by year, and also that's being more and more structured. Rare Disease Day remains a very key policy moment and advocacy moment for everybody. This International Day for Rare Diseases takes place the last day of February every year, and is coordinated by EUCERD, and really is truly global now, with nearly every country participating. We've also, on the international level, Europe helped lead work to revising the international classification of rare diseases at WHO level, making sure that rare diseases are included in this very important international classification system. In 2011, you see the constitution of the International Rare Disease Research Consortium at the initiative of the EU and the National Institutes of Health in the USA. In 2015, we see the development of Rare Diseases International, launched by EUCERD and the Nord USA as an alliance of rare disease patient organizations to help coordinate advocacy at international level. Rare Disease International, as I said earlier, has been mandated by WHO to work on global operation definition of rare diseases. So that's how we arrived at our operational definition of rare diseases, recently adopted. And at UN level, so there's this non-governmental organizations committee on rare diseases launched by EUCERD and the Swedish Angrenska Foundation, which has a UN advocacy mission at the UN and was key in generating the momentum to the 2021 UN resolution on people living with rare diseases that you may already know about. So this is a little timeline of the different interactions ending up with this international campaign to call for the UN resolution on persons living with the rare diseases, which of course brings out the different sustainable development goals that including principles of equity that we need to help bring about for rare disease patients living across the world. On the research side, you may also already know about, but just to highlight, there's a whole load of activities on research going on in the scope of the International Rare Disease Research Consortium. This consortium has had two main initial goals that were already realized a few years ago. So they have new goals from 2017 to 2027 that are very ambitious, aiming to reduce delay to diagnosis diagnosis within 1 year if the disorder is known in the medical literature. It aims to have 1,000 new therapies for rare diseases by the end of 2027. And new methodologies to assess the impact of diagnosis with therapies on rare disease patients. So they have a whole load of different activities going on to arrive at these goals in the future. And if you're interested in how the rare disease field is being structured at an international level, you can go on the website and learn more. So just to wrap up here. So how are the rare disease policies evolving outside of Europe? So it's important to note that the Europeans were the first to structure a response around rare diseases. In Japan, you have this concept of NAMBYO, so intractable diseases, that emerged in 1972 with specific measures to support those people living with these diseases at that point in time. And of course, the US Orphan Drug Act in the 80s. These were primarily focused on providing incentives for orphan drug development, so having a treatment available for these diseases. But now what we're seeing is an increasing number of comprehensive rare disease plans and recommendations for plans emerged across the world in the past 10 years, and the real organization of community. And what we see is a strong lead and advocacy, of course, by patient organizations who are really motor in making this change come about. So what we can provide from the European experiences are sharing our experiences, showing what we did maybe right, maybe did wrong. So I think what we can see at the European level is it's been very rich to have a fora available to exchange experiences and lessons learned. Sometimes what some countries have done have served as models for other countries, and this is maybe what we can share with the rest of the world, is how we went about things. And we have what we've maybe shown is the utility of a regional and cross-border approach, because no single country has all the expertise to serve all rare disease patients. As we saw, there are so many diseases where there are so few patients and therefore so little expertise. So we really have everything to gain from sharing at an international level. The Rare 2030 recommendations can perhaps also provide information and ideas and lessons learned from our 20 years of experience with working together at European level, maybe a help avoid some pitfalls. It's also important to keep this dynamic going, and also use this Rare Disease Day as a key moment when we can make this public health priority come to people's minds outside the rare disease field and advocate for it. So I'd like to thank you for your attention during this whistle-stop tour of the European rare disease policy landscape. If you want to learn more, I hope I'll be able to share with you these slides with some extra information. I'd like to highlight that we do have this Orphan News free twice monthly newsletter that you can access, that provides you information on what's going on in the rare disease community, both in Europe and at global level. It's a review of the literature, both in terms of policy initiatives, projects, and also the scientific development. So that's free for you to consult. There's also an important conference coming up next year. Every 2 years, Eurodis organizes this European conference on rare disease and orphan products. It's hybrid, so you can pass it online, and it goes across discussions on all themes touching rare diseases, and we'll really be looking at how to put into place these recommendations we've developed in Rare 2030, and how we bring about the change that we want to see for this to arrive at our preferred future. For you as journalists, I'd like to highlight a couple of Orphanet resources that could be helpful for you. So if you're looking for basic reference numbers and statistics on rare diseases to cite, we have this publication from 2020 that we co-authored with Eurodis on the global prevalence of rare diseases. So I link this in the following slide that will provide to you. If you want information on a specific disease, when you're maybe having a profile with a patient or a family, or you wanted to know more, you can use Orphanet and search for the disease. If you want to find professional or patient organization to interview, Orphanet. If you want to keep to date on priority topics and evolutions in the field, there's Orphan News. And if you want to search the background of a specific issue, maybe about data protection in rare diseases, there's everything in Orphan News, and also in the specific Rare 2030 knowledge-based fact sheets that I'll link after. And if you're really in for an in-depth analysis of a certain specific topic for reporting on it, we have these massive data sets on Orphanet. So I'll provide this after to you, and there's a couple of interesting publications that might be of use to you in the future. So thank you very much. I do know that I speak pretty quickly, and that's my problem, because I should have condensed a bit more, but I hope you bore with me, and I'm looking forward to your questions.
Thank you so much, Charlotte. For me personally, when I think of the issue of collaboration and cross-border communication about rare disease, what an incredible resource Orphanet is, and the many branches of things that you're doing. It's mind-blowing to me. I wanted to start before I open it up to the journalists, because I feel like this issue of cross-border collaboration. When I was based in East Africa, spent 9 years training journalists on covering health and healthcare access. One of the things that I tried to stress was helping journalists possibly influence policymakers to understand
Mm-hmm.
the need for these priorities. So I look at the map that you presented to us
Mm,
of the countries where you have collaborations, and
mm,
there were only two in North Africa that I saw,
mm-hmm.
unless I got that wrong. And so my
Ah,
question,
yeah, in the Orphanet network, yeah.
right, right.
Yeah.
So my question to you is, and is it such a challenge for so many journalists because they feel, what difference is my work making? How can I truly have an impact? But I wonder what your thoughts are about the role of educating policymakers about this issue, um, allowing organizations or schools or whatever in various uh, sub-Saharan African countries
Mm,
to understand that this resource exists
mm.
and that they can possibly take advantage of it.
Yeah. Thank you for the question, Rachel. So, in terms of the missions of Orphanet, of course, we started as a French initiative, and then we grew to a European one, and then a bit when there was somebody who came to us and wanted to launch Orphanet in their country, we've developed in different countries across the world, as you might see in Japan, in Argentina, etc., and so forth. So, I think one of the problems we have, of course, is we're publicly funded, and then we have to identify funding for all these activities, but we're always very open to opportunities for collaboration. But the thing you talked about, which was, how can journalists also play a role in making this issue known, maybe to countries who don't already have a policy in place. So I'd say that the Rare Disease Day is really terribly instrumental in making, being this advocacy moment and also talking about this issue. It's the moment in the year when at European level, if we have like a new policy at national level, it's announced. So I think it's something to be seized because then it brings the light onto this issue from a different number of sources, both from the patients and maybe also as you as journalists on this subject, a specific moment of time where it can be heard a little bit more and coordinated. So I think that's something to be seized upon. And I think I may be missing an aspect of the question that you asked, Rachel, but
Well, so
I
I
think,
guess, well, when we think about preparing for Rare
mm,
Disease Day
yeah,
2024,
mm,
a journalist in a country like Nigeria, for example,
yes,
perhaps there's an opportunity to attempt as much as possible to quantify
mm,
the numbers of cases of sickle cell in
yes,
Nigeria,
yes, okay, yeah,
to
mm,
talk about some of the things we've learned about genetic
yeah,
therapy and genomics, et cetera,
of
and
course, yeah,
then to elevate the issue so that perhaps someone in the Ministry of Health or
mm,
whatever could say, well, there's this resource
mm,
in Europe, there's Orphanet,
mm,
and perhaps if we connect to Orphanet,
mm,
I'm just trying to talk that through, but I
yeah,
wonder
yeah,
if
yeah,
a journalist were to attempt to do that,
yeah,
they could depend on Orphanet to sort of provide that support.
yeah. So, one of the things that Orphanet provides to everybody around the world, even if there isn't a country team in place, is access to information in a different number of languages on rare diseases. So irrespective if somebody can, there are 9 languages available, one of which is English, so as a global language. So there is information that can be accessed if you have a team or not, of course. And then what we do curate in terms of, for example, if you're looking on to know what is the prevalence in your region or your country for a certain disease, as that might bring some added value to the subject you're writing about, is that we document if there is a peer-reviewed publication or an epidemiological study concerning that patient population, it is documented in our database. So that's something you can also access and use as a resource. Um, and in terms of extending alternate country teams, I mean, that's something that is possible for any country if they wanted to join the network, and if they wanted to bring that attention to healthcare authorities. I mean, it's really what we ask when a team joins is that they have the designation of their competent authorities. So that can be the Ministry of Health, the Ministry of Research, and so on and so forth. And then they help collect the information around what services are available in their country. So that's something that also, if you're asking people to collect this information, it also makes the policymakers structure also the expertise around that. So there's a lot of issues also around how do you fund these activities as well. So it's sometimes that's why we see rare disease policy at national level comes hand in hand with an engagement for supporting these sorts of resources.
I would also urge journalists to consider a story about evidence and data and the role it plays in getting healthcare resources to people in your countries. And Rare Disease Day could be the way to talk about that broader issue. Let's get to a couple of these questions because I want to make sure we give the journalists time to speak. Julia Metro of Mother Jones here in the U.S.
Hi.
Hi.
I have something that between even the same drugs, for example, in the US versus France, the drug itself is almost always more expensive in France.
Yes.
Sorry, not France, US. It's almost
Yeah,
always more expensive in the US. I'm
yeah.
wondering if you could talk about if maybe stakeholder expert groups have played a role in how EU countries negotiate the cost of rare disease drugs, or has this always been like a larger thing that has just happened?
Yeah, so we have a common orphan designation process between the European countries. So when the orphan drug is given the approval to be launched on the market in Europe, it's done at a central level, but that doesn't mean it's launched in every country. And in terms of the setting of the price, it's kind of the procurement doesn't take place at European level. I mean, we've looked at that for the vaccines, of course, for COVID, but for orphan drugs, it's each country, and the drug price varies wildly from country to country, and there's very little transparency around that. So what we had done at the expert group level in the past is we looked at, how the frameworks for assessing maybe the clinical added value of certain diseases when we talk about health technology assessment issues and reimbursement issues. But unfortunately, it's even very hard to know how much each country pays for each drug. And that's one of the I think one of the barriers, having this barrier to the information also helps. It also constitutes also a barrier to making these drugs more widely available, because if we knew what everybody else was paying, it might have a more of an impact on bringing prices down. Yeah, so I know that. So we haven't had a lot of time to talk about everything, all the issues around the pricing of orphan drugs, but it is one of the things to be worked on, because there are the treatments out there, but they're very expensive, and more and more treatments come out, and the funding for drugs sometimes is diminishing due to general stresses on budgets at national level. It's really becoming an issue where people are saying, "Oh, orphan drugs are costing too much," and so this is a subject you will see come up, of course, every time there's a new drug with a wild ticket price that's announced, if it's in Europe or in USA. So there's lots of interesting literature around that, of course. But we try to do our part in kind of establishing this framework, saying what is a clinically added what is the clinically added value of this drug. So I'm not sure if I gave you a full response, but I say it's a very difficult issue. Because we don't all have the same cards in our hands when we're talking about it, I think.
Let's hear from Valeria Guzman of Al Haraka in El Salvador.
Hi, Valeria.
Thank you. I'm sorry, my connection is unstable.
Oh, don't worry. Yeah.
Oh, so do you want me to read your question?
I was wondering if there was anything like Orphanet focused on them.
I think I can't hear Valeria, but I see in the chat that she had put a message, so maybe I respond to that. Because Valeria said that this is the Orphanet is also it's in Europe, but is there any similar project or portal like this in the Americas? So as I said, we do have a team that was developing activities in Argentina, and then we had a few different contacts in Brazil and also in Chile, in Peru. But for the moment, I think there might be a initiative in Colombia because we discussed with them yesterday where they're trying to bring together knowledge around this. But as I said, I haven't got a knowledge of something that's exactly like Orphanet. So, but I will also include in my slides, there's a whole list of references in terms of what's been developed in different countries in terms of policy responses to rare diseases. So from peer-reviewed literature. So maybe there's something in that could be of interest to you.
Let's hear from Rupsha Chakraborty of the Indian Express.
Hi. So Orphanet also works in Asia, right? And as we know that the region's data consolidation is very vague and ambiguous. So could you share your insight and perhaps draw a comparison between the data collection in Europe and Asia based on your experience? How was your experience in collecting the data between Asia and Europe?
Okay, so we don't have any Orphanet country teams. I don't know if your question is around collecting data on patients or just knowledge on rare diseases in general. All right, patient data, because one of the things to just to highlight is Orphanet doesn't collect any patient data. We're amassing knowledge on rare diseases, and we're providing these author codes to be used for patient data codification. But I don't have much experience of what is going on in Asia, but what we're doing at European level is providing the standard nomenclature so that each country is using the same way of describing diseases, and this is made available to any country. So if a country out in Asia wanted to put into this to place or even translate the nomenclature into their local language, they could. I'm sorry to not have a better grip on how the data collection is taken out, but of course one of the major hurdles is really to collect data from different sources. We know that for rare diseases, a lot of the data has been in specific disease registries. And what we might want to do if we want to have a better idea of a global picture of the number of people with rare diseases and where they are and what services they need is to bring these different data sources together. And that's why I talk about the importance of having a standard code for rare diseases is to have this interoperability key to bring these different sources of data together. So I'm sorry to not have a firm grip on the situation in India, for example, but it is what we provide at Orphanet for the author codes is something that's linked to should make data more easily interoperable between different terminologies that are used, such as SNOMED or International Classification Diseases of WHO. So that's something we make available for anybody, irrespective of whether they're in Europe or not. So that's a roundabout way of answering your question. So.
I'll take the last question here because I think it's something that's very important, whether you're in New York or Namibia, and that is the role of information in fueling policies. So often I heard, again, during my time abroad, that reports are generated and people go to conferences and then the report gets stuck on a shelf and nothing's ever done about this particular issue. And so for journalists, in terms of interpreting the impact of policies, I know that in one way, telling stories is the gold standard in terms of getting people to care about issues. But
yes.
Can you give the journalists on our call today a takeaway about the need to embrace information, to understand policies, and to stay aware of what's available when it comes to possibly moving the needle on rare disease policies in their country?
Yeah, but I'm convinced that if you want to have an effective policy in any field, it needs to be informed by real world data. And what we're trying to do is help provide amassing all this data and knowledge around rare diseases so that they can be employed to make informed policy decisions. And that's what we're quite convinced of also in the Rare 2030 project. So I'd also to encourage you to look at what we did within this project, see how we looked back at what we'd done, drew also lessons learned, looked at the different drivers, the instigators of change that we'd seen in the past 20 years, and maybe the different wildcards to see how this could affect the future, and how we could work on what, you know, the levers of what had worked previously, and resolve things that hadn't worked. So and I think what is very important in the rare disease field is to recognize also the when we're looking for drivers of change, is really listen to the patients. They know what's going on. They are experts of their diseases by necessity, often, because often they've had to advocate for their own, of course, for their own care when there weren't suitable solutions provided in their own healthcare systems. So I think that's where, especially in this field, as reporters, the patient story, the narrative of the patients can give some keys to understanding, and also improving how we make the policies that we make available to tackle the issues they encounter. Yeah, so I thank you everybody for being here, because I think we need people that can carry voices louder, higher on the international level, and this is hopefully what you'll be able to do when you finished your week, of course, and use this, as you'll hear on Friday, this key moment of the calendar, Rare Disease Day, when we can amplify our voices even further, because we're all talking about the same thing at once.
Charlotte Rodwell, you have given us a tremendous and comprehensive scope of the European policy scene, but also the opportunities to learn from it and connect with Orphanet. So thank you so much for joining us on day 2.
And thank you very much. And please do get in contact if you have any questions afterwards. I'm very much available for talking or emailing about any issue you might want to talk about.
Great. And that does conclude day 2 of the Covering Rare Diseases Fellowship. And we've had some powerful conversations today, and I look forward to what tomorrow brings. Thank you.